that was given to the Empire Plan employees, and I wanted to share that presentation with you. And what I did is I'm going to take snippets from that presentation that pertain to you if you're an acupuncturist or a massage therapist. So let's go through it, and I'm going to stop it and explain what it is that is changing as we go through this presentation. So let's start.
Welcome to this informational presentation regarding the Empire Plan. Changes are coming for most Empire Plan enrollees starting July 1, 2023.
So as you can hear, the plan is changing. It's changing for most employees, not all employees, most. And we'll find out who it's changing for and who it's not, although it's still a little vague, but we'll take a look at that.
The purpose of this presentation is to explain who is impacted and what is changing. The information.
So who is impacted? And let's look at it. And we're going to look at that slide as it's loading.
The changes presented here apply to the Empire Plan only. This presentation will highlight key changes to the Empire Plan effective July 1, 2023 for the groups noted on this page.
So only the group notice on this page, then I paused, are where the changes apply to. It's still very vague, but you can see it's the civil service employees, right? They do list out which employees it's changing for, but it is not clear. You will need to ask your patients if they are part of these groups or these unions specifically, or are they not? And if they are, then the plan is changing July 1st, okay? Let's talk about what's changing, and I'm going to click on the next slide because what you will see through the next slide is that the deductibles are not changing, the out-of-pockets are not changing, and you'll hear that now.
We understand your Empire Plan benefits are important to you, and it's important to note that the upcoming changes do not include any increases for your copayments, deductibles, or out-of-pocket maximums.
So you can see that this out-of-pocket maximum, deductibles, or copayments, none of that is changing. What is changing? Let's click on slide 11. That one applies specifically for acupuncturists, and let's listen to these changes.
For acupuncture services, coverage is available for up to a maximum of 20 visits per calendar year for you or your covered dependent when you choose a non-participating provider. This is a combined total for all non-participating providers you visit. Acupuncture visits to participating providers do not count towards this maximum, and visits prior to July 1, 2023 do not count toward the 2020.
Okay, so what are they saying? First of all, these changes are to non-participating providers. So if you're in network with the Empire Plan, this does not impact you. If you're out of network as of July 1st, they are only allowing 20 visits per calendar year. Those 20 visits start counting as of July 1st. Anything that the patient had before does not count towards the 20 visits. Okay? Let's talk about LMTs. What's changing for them? Let's listen to that.
For massage therapy services, coverage is available for up to a maximum of 20 visits per calendar year for you or your covered dependent. However, it is important to note that this is a combined total for all massage therapy visits, regardless of how many providers you visit. Visits to a network managed physical medicine program provider, such as a physical therapist, do not count toward the 20 visit limit unless a therapeutic massage is part of treatment. And visits to any provider prior to July 1, 2023 do not count toward the 2023 visit maximum.
So, similar to acupuncture, the 20 visits start on July 1st. If the patient had any visits prior to July 1st, they're not going to count towards the 20 visit limit. We are going to learn more information as the service centers actually have it within their system, and we will share it with you. This is what we have thus far, and we wanted to share it so you are aware of what's coming and what's changing with the Empire Plan. We will keep you posted. It's Sarit again from All Acu Services, and we'll continue monitoring and providing additional information.